we really appreciate you guys coming out here. I mean, really, it's just we always want something to invite some people over here because we're always eager to educate. That's something that both me, Michael, and Dr. Shin, we're both. And that's why we send out a lot of videos, just educational materials. We always have something to say about that. I always have to watch myself when I go to parties. I'll be like, okay, instead of talking, like maybe I'll talk about your limp. No, we probably should talk about, something else. So, but doing it all day long, I still tend to like to do it. So, we're just happy to have you guys here. Right now, if hopefully everyone's got one of these, But, this is our clinic, NewCare Physical Therapy. We've been here about a year in this location, a little over a year now. But we've been open about 3 years, and we've been doing this for about 7 years, I think, for Dr. Shin over there. And, we're new to this area right now, but we've been treating in this area, and just trying to get the word out, that there's like a solution for back pain that isn't, drugs, it isn't, surgery, that there's another solution out there. So but just welcome. This is this back pain and sciatica workshop. And we're going to just teach about a few things to watch for. But first, I just kind of want to know, why don't we just do a little group activity, see where everyone's at. Okay, I'd like everyone to stand up. All right, so stand up. Let's just watch yourselves, but we're going to just go down and try to touch our toes. If you can't do that, if that hurts a lot, don't do that. Down all the way, and then stand up. All right, now we're just going to bring arms overhead, and then kind of arch back forward. All right, anyone have pain with any of those movements? Okay, all right. All right, now let's just cross our arms. Let's just rotate to the left. All right, and rotate again to your lefts. All right, all right, and then back. Any pain with that? Okay, so I will need to have a seat, but I like a volunteer. I'm just gonna try a little magic trick. No, not really. I'm just gonna try and just show you guys a little bit, like what some of the exams look like. So, all right, we got a volunteer here. All right, and this is Chris.
Chris.
All right, Chris. We haven't met before. This is our first time meeting, right? You're not my friend. You're not okay. All right, have a seat here. All right, and so you were talking to me a little bit earlier, and you had a little pain when you're kind of bending forward. Okay, and so is that the same time you had pain right there? All right, and so where did you have the pain? If you could use one finger, just point it out.
Right here.
Okay. All right, so your pain is a little bit high up there. How about when I press here?
Not there.
Okay, so right here and this. All right, so what I want you to do, you lie down on your back with your head over here. Okay, you just say it was on the left side. All right. Your right side, sorry. This side, right?
Right.
Okay. Let me take a quick look. Does that hurt at all?
A little bit.
Okay, that gives you a little pressure there. Okay, bend both of your knees. All right, bend the knees. All right, rotate this way. Any pain here?
Not much pain.
Okay. Any pain with that?
No, just muscle soreness.
Okay, and then bend your knees. Okay. Any pain with that?
Yes.
Okay, and that brings on that pain still right in that spot right there. Okay. All right, bring this leg forward. So from what you've told me, all right, press down. You kind of have a lot of pain in the hip. PSI, you kind of have dimples in the back, so like the SI joint. It looks like there's some irritation specifically in that spot, especially since you pointed it out with one finger. Okay, and so what I'll do is just some of the light stretches that sometimes helps. Just start off just to loosen that up. Any pain with that? Okay, do you feel a stretch?
Yes.
All right. Come across. Any pain there?
Just on the ball joint, but that sounds like it's normal.
Okay. Just kind of a stretch, right? Okay. All right, how about this way?
Yes.
Okay, it's still right there in that spot.
It's a little bit more inward at that.
Relax. How about now?
No.
It's a little different. You feel a little stretched
Now
out.
there's a little bit of pain.
Okay. A little bit there. Loosen that up. All right. Okay, I'd like you to lie on your stomach now.
Okay. Gonna pull my phone down.
Yeah. Thank you. All right. So some of the pain's right there. Okay, I'm gonna apply a little pressure right here.
Right here too.
Yeah. QL. I'm gonna press here.
Okay.
Any pain there? Okay. So immediately right here. Okay, I'm gonna apply a little pressure here. You feel some pain there?
Not so much.
Okay. What I'd like you to do, use that right arm. Okay. And you're gonna put it right here. And I'd like you to do almost in a push-up position for me.
Okay.
Yeah. And then I'd like you to just press up a little bit, rotate this up. Okay, any pain there?
Not so much.
So I'm just going to do a little bit of a mob right here for this joint area.
Pains when I go down.
Yep. So trying to loosen up this joint for you. All right. Okay. I'd like you to sit up again and just see if that, how you feeling after that. Okay. All right, stand up. All right, just bend down, touch your toes. I know that was what hurt a little bit earlier.
Still
and back
good,
up.
but it's not nearly as bad as it was before.
Okay, great. So already a little bit of improvement. It'll take about 3 minutes. Okay, great. Go ahead, have a seat. Okay. So I mean, when it comes to back pain and sciatica, you know, there's a lot of areas that can be causing the pain. So let's try to simplify it a little bit. All right. So if we go back to the sheet, what is sciatica, right? So when we talk about sciatica, we're talking about the nerve, all right? There's a nerve. It's the longest nerve. It's a very thick nerve. It's very surprisingly thick. It's like imagine a rope, okay? The gauge is about, you know, the diameter of a quarter, right? And the sciatic nerve is the longest nerve in the body. And it's actually split nerves. It's two nerves, okay? And it travels from the back, down the back of the leg into the foot, all right? So it goes from the low back of the leg. That's why sometimes you'll feel it in the butt, in the back of the leg, and then into the foot, sometimes tingly or numbness in the foot. Pain running down the back of the leg caused by a problem in the back. So that's what you have to think about, right? Now, what sciatica sufferers typically may experience is some tingling, some numbness, or pain in the leg. Okay, when we talk about nerve pain, when I'm asking people, are you feeling a nerve pain? I'm asking about, is it like a burning sensation, tingling? Is it more like numbness? That's typically more meaning that the nerve is affected. Now, if it's an ache, then it could still be the nerve, but it could also be something else, like your muscles. All right, but a little bit more about us. Michael and Michael, the owner, we're both owners of NewCare Physical Therapy. And, you know, we came to specialize in this area, one, because it's just such a big problem, but two, why do we even open this place? Because, we've been to worked in a lot of different areas before, doing physical therapy. And, we find that, our techniques with using our hands and the way we educate, it's not really necessarily done in all the places. And so we just have our way of how we like to communicate with our clients, how we like to care for our clients, which is typically using more manual. And that's why we have all this equipment, laser, we have needles, we got cups, we got traction machine, we do the ultrasound, but we also trying to be more on the cutting edge with the newer stuff too. Anything, really to reduce that inflammation, and so we find that, these manual, these techniques, a lot of people know them, but, if you don't have your clinic set up to be able to do it, then then what's the point? So we were in a lot of places. We had the skills, but we just couldn't apply it, the way we wanted to. So that's why we got together. We were buddies from high school, kind of knew each other while we were taking some courses for PT school, and met up after we were working other places. We were like, hey man, let's just do it. And so here we are. And
yeah. Okay, so now you said that your clinic is set up to do more manual. And one of the problems that I had, the reason why I decided to go out of the Kaiser network and pay privately, is because I was told when I came back, I came to you and then I came back to the Kaiser paid group. And they asked me, well, how was it? I said, oh my gosh, you all should just close down and go over there and at least steal their stuff so you could actually treat people.
Yeah.
And they were like, and I said, yeah, I'm just being honest with you.
Yeah.
So then they told me, well, to defend their position, they said, well, they're probably a boutique. And I said, no, but go ahead. And so they said to me that because insurance reimburses us, we have to give you something to do when you go home. And I said, well, they did, and insurance reimburses them. And so it was all of this talk to defend why they're lazy. And being a therapist, I too know the difference between when someone truly is dedicated to the mission of healing and when someone is just there to do their little thing that they've done for 50 years and they're not interested in healing. They're just interested in doing whatever they're told to do, whether it heals or not, because it pays the check and they don't have to worry about anything.
Yeah.
And I think that's such a disservice.
Yeah.
Because they're getting paid.
Yeah.
Because Kaiser's paying them. But I can ride a bike at my own house. I can do my own exercises once you give them to me. What are you doing to take care of the pain?
Yeah.
And their technique for dry needling is like death. So I don't get it. I'm not going back. I'll just pay out of pocket. I'm done.
Yeah, it's Yeah. Well, thank you for sharing that. Yeah, I mean that's exactly what we were talking about. And I've been talking about. We've been to those. We had to work for those kind of places or a certain. And it's just the system and the environment that you can create in a clinic. So that's also part of my job, being a business owner, is creating an environment where even the PTs can even apply that. Because those PTs probably know how to do it. It's just maybe the environment or the system they're in, it just doesn't quite allow them to do that, given a time or something like that. But thank you for sharing, but, that's really, our backstory, all right? And so, the first thing that people, how people can, think about their pain. The first thing that I like people to imagine with their pain, okay? When it comes to numbness and tingling, when it comes to sciatica, is it something that's reproducible? Is this something that, they know what, they're doing something, they know what a movement, like you said, sitting, standing, walking. Is it one of those that reproduce it? Because some people have pain constantly, and then those become a little bit more difficult to deal. But if it's reproducible, if so, then it's most likely reducible. So it just increases the likelihood for that. And then when it's reproducible, you're thinking, do you have pain with standing? Is it walking? Is it sitting? Is it lifting something, changing positions, standing on one leg? Is it in the morning? Is it at night? Is it long drives? Those are some things to think about, because those can be telling of what kind of back pain we're dealing with. But the biggest, and that's the biggest mistake that most back pain and sciatica users, or back pain and sciatica sufferers make is that they just deal with it. They ignore it. They don't deal with it. They ignore it. They kind of just put up with it. tough it out. Because if we imagine, when we're younger, you have a little bit of pain. Okay, you just take a little week off, and then you're back at playing, basketball or football or whatever it is. Even you sprain an ankle, it's swelling. It takes about a week, and then you're like, okay, it feels pretty good. I'm just going to go, put a little brace on and then, play some basketball. But that only works for a little while, but it did work. So people are like, okay, well, it just takes a little break. So it worked before, when I was, 12 years old. And so now that I'm 40, it should probably work again. And so they just kind of ignore it and just like, well, it'll just go away one day. So one week becomes a month, 3 months, 6 months, and then you're here a year. And then after a year, sometimes it's years, And then, so you just ignore it. So the first thing that people do is they ignore it. The second thing they do is they'll just what's it called? They'll adapt to it, right? So you're saying, okay, well, it hurts when I'm playing. If I lift anything heavy, so I'll just not lift anything heavy. I'll just hire some other people to do my yard work or something. Or, it hurts when I play basketball or sports. Well, I'll just break down the sport to maybe more just swimming, because that's what people say. Swimming is the best thing for you because it's easy on the joints. So I'll just swim, but then they're swimming and they're like, okay, well, swimming hurt a little bit. So now I'm just going to walk in the water and do the, aerobics. Or sometimes they'll just say, oh, I'm just going to quit exercising. I feel comfortable in my chair, so maybe I'm not sleeping in my bed anymore. Now I'm sleeping in my chair, my recliner. This is just temporary, and then it becomes years. I've been sleeping on a recliner. I just bought a really nice recliner so I can sleep on it, And then, I do some home health. So I've seen some people, they're like, oh, I'll meet them in their chair, and they're like, well, this is pretty much where I spend all my time. I'm right here in this chair, And so, and then, so that's kind of that's a kind of a bleak picture, but that's kind of where that can go to, And then the third thing that people can do, though, is just to deal with it, right? They work on taking action to deal with their back pain. They make that choice. It's a difficult choice, really, to like make the commitment to deal with it, but dealing with it is the best thing. It's a mental thing, because we're trained from, when we're really young to think, oh, it will get better if I ignore it or if I rest. But dealing with it, all right, going to see a specialist, that's, or doing what you guys are doing, just finding more information about it, right? Trying to get that education. All right, so let's get to the 3 common causes of the back pain. I'm pretty low tech when it comes to this stuff, but I feel like it. I just low tech when it comes to this stuff. All right, so let me just draw a little back for you guys first. That looks like a pretty good back. All right, so there's the pointy side. Where you guys feel that stuff? There's the stomach side. All right, so when we're thinking about herniation, right? So we're thinking the first one is a herniated disc. And typically when people have a herniated disc, they feel pain when they're bending forward, typically. All right, that's when it's really extreme, okay? It could be a disc issue. When you bend forward, you're feeling that sciatica down the leg. All right. And when we look at our back, we have kind of this little, some gel back here, and then our nerve, it runs through here. It's nice and protected. Okay. So herniated disc, there's some contact here, all right? Kind of the disc kind of bulges out, makes a little contact to the nerve. The second thing most common back issue is degenerative disc disorder, or stenosis. It's kind of like an arthritis in the back, all right? And that's kind of, and then we're thinking with that, it's pain with standing or walking typically. And so a little stenosis, typically you might be leaning on a cart, and feeling a little better just leaning on a cart while you walk. It's typically with that, the extension. And so that's more degeneration or stenosis and irritation, like where the bone is. Okay, that's more the stenosis, all right? Now there's another area which is that could be mimicking or giving you symptoms that are sciatica-like, and that's the SI joint. So we're thinking of our back, a triangle, elephant ears. Okay, so when we're thinking about that, we have our low back, tailbone, hips. There's a connection between the hip and the tailbone, right? And so SI joint pain, or a pelvis problem, sorry. That's for the workbook. Typically, you will feel it right there in that joint. And irritation there sometimes can send and mimic that pain down the leg. All right. And this is typically that pain with sitting. Now, those are most common times of bending forward, standing, or sitting, but it's not always that. But it's kind of a good indicator when people are telling me their history. Okay? And so how do we treat this stuff successfully? It's kind of like, it's considered a European style, just because, but really it's a Michael style. It's a NewCare style. Basically, it just involves a little bit more hands-on, right? And so hands-on PT to loosen the pelvis. All right, that's the first box, right? To help loosen the joints, right? Functional exercises to stabilize the pelvis. All right, so functional exercises meaning things that actually have value in the world, where maybe it's squatting or maybe it's lifting a light but just doing some exercises really to stabilize that pelvis. Occasionally we do traction as well, and traction just helps to loosen that the pelvis, the joints up, and just create a little bit of space to alleviate if there is a herniation, that kind of pain. Yeah.
What causes the pelvis to get unstable?
Well, a lot of times it could be an injury, right? That they're stiff. It's not necessarily unstable, or sometimes it's too stiff too. And that irritation and inflammation is right there in that spot. And you just feel it right there in those dimples. That's what we're talking about. And so, in the case of Chris, I was doing some mobs that just help alleviate some of that tension, just move, create some more space in that joint, just to help decrease that tension. And that's usually a lot with the sitting, especially if you're a driver, I think, right? You're going to feel it, and you're just stiff,
I stopped sitting on my wallet. A lot of people say, if you ride around all day with your wallet in your pocket, you're already kind of off.
Yeah.
But for some reason, I drive pretty much every day, and I get home. I mean, I'm feeling fine. It's just during the course of the day, that pain, it won't even go from my back. It's basically, because the other day I worked out, and I was just typically riding the bike, rode the bike about 30 minutes, and probably did some leg press on the machine, something similar to that, and just did a couple of stretches. And it seemed like not the next day, but the next 2 days, man, that traveled all the way down to my calf muscles, man. Mm-hmm. My calf muscles were so tight, I could even hardly walk.
Yeah.
From a distance, I was like, man. I
Yeah.
was just stretching, just constantly stretching, and it just seemed like it didn't do any good at all.
Yeah, yeah. So I mean, there are certain That's why it's very important to also do the right exercises at the right time. You know, at the end of this, actually, we have some just low back exercise. I think that's what I posted, like 3 very common exercises you can do. Just print those out. Very easy things you can do in the bed, just like rotate, very similar to what you guys saw a little earlier. That will give you guys at the end of this. At this point, that's really all I really just keep it simple when it comes to the back, just to talk about that, because I'm sure the histories and the stories are very different. It's always very different for everyone, but just having this kind of information, hopefully this can be enlightening to you guys. You guys have any other questions? No Q&A.
How do you know the difference between the sacroiliac issue and the other, like herniated disc or?
Mm-hmm. Well, actually, I'll have Dr. Shin help answer some of these.
How you guys doing? Sorry, I got a little carry over treating. I was gone for 3 days, so I had some patients that I need to see. So this morning I ended up seeing a whole bunch of patients. I opened 2 hours, I ended up seeing 6 patients. So, but anyway, so your question in between SI joint, sacroiliac joint versus lumbar spine, lower back pain. How do you differentiate without diagnostic tools like MRI, X-rays? Is that we have some clinical judgment rules and some of the special tests that we can actually rule in and out, and they could be 40 to 60% accuracy. So actually we have a provocative test for the SI joints. So if you're positive out of a 3 out of 5 provocative tests, then likely chance that it's not lower back. The stability joint versus a lumbar spine is actually the mobile joint compared to the SI joints. So, I look at 2 things. Is it really the lower back causing the SI joint? Is it SI joint causing the lower back pain? It could be vice versa, really. But what matters is that we treat the symptom and cause. It's not so much of you have a pain there and then you treat there. But once we have the right diagnosis, then your treatment plan can be changed depending on what can work. It could be simple manipulation, it could be simple traction, whatever modality or the treatment plan that we have, it can make you feel better or not. That's why it's a specialty involved in sciatica. Treatment, it can't be just generalized, exercise and you're gonna feel better. Yes, there is a common exercise that we do for all the lower back conditions, but if it's a specific area that you have that problem, then we need to address that issue. And that's how I know that and sometimes you treat and then we find that it's not lower back. You treated like 3-4 visits and you didn't feel any different. Then it's already given. Treatment is not working. I'm not gonna keep on doing the same thing over and over. So that's the number one mistakes that a lot of therapists make, because they come in because a doctor wrote a prescription to do this, and they do that and then didn't feel any difference. So then we end up getting the patient back and say, I went X, Y, and Z, and then it didn't work. Well, then they need to change or reassess and see where things are. That's where the diagnostic, for PT diagnostic, we have a special test, and some of the examination is viable. Yeah. So really, the question, we need to diagnose by doing our hands-on and different tests to figure it out. We can pretty much tell, roll in and out. Of course, it didn't happen in one day. I have a 9-year experience treating sciatica and lower back pain, and then dry needling and manipulation. It just takes time to find out what's going to work for you. That's the key.
And then a note to that also is, even with an MRI or even with an X-ray, sometimes it's very obvious, but sometimes it's guesswork. With the MRI. Even if I did an MRI on my back, I probably have some herniation or herniated disc that someone would say, oh, it looks like it's protruding a little bit. And they've done tests on this, just to see whether you're symptomatic. So they just tested a bunch of people, and with or without pain, and they saw that about 65%, all had disc herniation. Not everyone had pain, right? So, it's just you have to be careful with some of those diagnostics too. Just to say, it's very easy to say, okay, it's that, all right. But a lot of times they'll come in and we'll find out it's this, the SI joint. you know, and we'll treat that. And they're like, oh, okay, I'm better, you know. So that's just, you know, some things to consider. All right. Okay, so if you guys, you know, I talked about dealing with the pain, you know, so I want to give you guys, you know, an opportunity also to deal with it. You know, we do discovery visits, you know, for, I guess, anyone watching. Am I being broadcasted? Okay. Anyone watching, I guess. Yeah, we can do a free discovery visit. Just talk to Rhonda up front. She can schedule something next week. We also just sign up for our email, because next month there's a day we're going to do for a laser treatment. Okay, that you can kind of taste, like a sampler, a taster of a laser treatment, and see how that works for your issue too. It's one of the it's a pretty cool thing. It works really well. So.
Oh gosh. It really does.
Yeah.
That's
Yeah.
awesome.
So after, I guess that's all I really have to say for today. If you, we'll be hanging around. So if you just want to talk about something a little bit more private,
Yeah,
you know,
I got
we
two
can do
questions.
that. Yeah.
You know, you go in the mall, and maybe it's just the mall in Georgia. I'm not sure if it's other malls. These guys, they'll sell these.
chair?
Not the chair. They'll sell these little pocket-sized
Stim
vibrate-
pad,
yeah,
the e-stim pads. I
yeah,
saw
they
that
put
at
them on.
Lennox. Yeah.
And you know, they'll turn up the volume. You know, kind of like, I guess if you go to a chiropractor, they basically do the same thing, where you kind of feel that nerve tension in there.
Yeah.
And then you kind of turn it up a little bit, and it's like, I'm trying to figure, does that really work?
The TENS unit, yeah, it's called TENS unit, right?
Mhm.
So we sell it here too, but it's for more of a temporary relief. Whenever you have a pain, you can, put those patches on
Yeah,
the
yeah.
area. And basically what it does, one, when you turn it on and stimulate that area with a different, type of electrode or whatever,
Mm-hmm.
it kind of blocks the pain signal so that you feel that sensation instead of the pain. So it is a little better than pain medication because it's more natural, right? But does it work all the time? No. It's more of like a temporary to reduce the pain. What I do is I usually do to reduce the pain at the end of the treatment or before, so I can do more things. But a lot of times they've done it before, it didn't work, I don't really touch it. But it's up to you. Is it really, helping or not?
Yeah.
It probably do. It's better than taking pain medication. That's what I tell them. But I don't know what they sell at the mall, and they're not healthcare related personnel. So now just, they open up to the public now. But beforehand, about 10 years ago, you couldn't even disperse that, in the
Yeah.
mall or
And
anything.
it's
So it's a
probably-
newer,
Yeah.
So what we do is we get it from the FDA approved provider. We get it from the different type of distributor, and then I know I used it on patients before, and that's what I distribute. And the machine that I have here is a lot higher quality. It's more of a home use base, as ours is a more commercial base kind of. So I trust my machine, and we get it every year we get recalibrated, so we know that it's working okay. So that's the key for me. Like, should you trust those mall type of machine? I'm not sure, but my suggestion is if you're not sure, then go to CVS and they sell it same one too over there. So or online, you can try it, But it does help some occasion. But is it gonna solve your problem? No, because your problem is driving long time, and you're stretching the ligaments and tendons, and you have some alteration in your lower back.
Yeah. And I also think about buying a teeter machine. How you see the advertisers, the old guy
Teeter?
with the teeter,
Inversion.
Oh,
table.
inversion table. Yeah.
bending up and down, and doing this and that, kind of like what you were describing.
Yeah.
Where, you got something bulge in between those.
Yeah, the disc.
Yeah.
Where the dude, if you kind of like upside
Yeah.
down, it kind of just basically
Yeah,
stretches
yeah,
you
yeah,
out,
yeah.
and kind of just
Track.
Yeah.
kind of.
Only thing about those inversion table too, we can't measure how much tracting is happening. Whereas I do have a mechanical traction machine. That's one of the treatment that we do here, or the chiropractor, they call it a decompression therapy. The only thing is that the machine, we can actually get, the segmental traction versus inversion is more of a whole body traction against the gravity. Yeah. That's what I'm saying. But does it help? Yes, it can.
Yeah.
But how can you utilize that without the consult with the healthcare personnel to make sure it's not gonna hurt? Is questionable because they tell you just go back and then for 10 minutes, oh, it's gonna hurt your back. If you had the lower back pain and you do that for 10 minutes, you come back all limping, yeah. Well, it's not my responsibility at that point, but we discussed together, is it gonna help? There's a certain way to use a TENS machine. You shouldn't use it all the time because your body's gonna get used to it. Inversion table, same way. If you do the constant pull, what is it going to your body when it goes back? You're gonna have more pain. So it needs to be intermittent traction, where it pulls and then let go, pulls and let go. Now, inversion table won't let you do that, versus our machines do. And I can measure exactly how much pound we can pull and push. So that's the difference, really. But it does the same thing eventually, and I do believe that everything helps. You know what I mean? Everything helps, but it depending on how you look at it, how you use it in your condition, right? So that's what we need to figure it out. That's why we do this, to educate patients, to let them know that whatever you're doing is helping, but is it getting rid of it? Do you know the cause of it? You don't, then we got some issues there.
And one of the other things I was going to mention too is that, if your schedule is really, really busy and it's, limited for time, you would do yourself a great service to, if you're going to use some of that, like that mall issued TENS unit, at least come for a couple of sessions and learn how to use it, because it was physical therapy that had to show me, you have to place the electrodes certain places for it to be effective, and you need that trained person to be able to do that. And then when you come, you'll find that that's probably not even the one that you really should be using. You should be using something else. So.
I have clients bring their TENS units here. Everyone, like, I have some military personnel. They've been issued one. They're like, I had it for 10 years, and they bring it like, oh, I've never used it like that. And it's like, yeah. It'll help at least, manage some of the pain. I mean, think about it, some of your daily activities, you have to think about your sport, it's your job, it's your work. And so you got to do it even if you have pain, Just like if you play a sport, you have a little bit of a tension, you just put on something, at least a brace or something, so at least you can, so I have some competitive athletes, I'll be, okay, well, I'll tape you up because you got a big meet. But, after that meet, just come back, slow it down a little bit and let yourself heal. But, I know you got to do it. So, here's some, tape, or wear this kind of brace or this kind of compression. Use this kind of like pad, at least to get through it, and then to do your job, to do your work, like driving or standing or whatever. You got to do something, prep yourself to get through it. And then afterwards, heal. It's just like hiking. I mean, you have the equipment. Sometimes you might need like some sticks. Sometimes you need the right shoes or something. You just think about it that way. Don't think of it like as a crutch. But you do got to do. You got to do what you got to do. So and that's what I really try to help people to get to, like to have that mentality. So just don't just avoid everything. But hey, I know you got to do what you got to do. You got your goals. I'm going to help you reach your goals. That's my job. Yeah. All right. Well, if that's everything, thank you for coming by. I think I got 12 donuts I got to eat by myself, but that's cool. Once again, if you have any questions, we try to dish out as much information as we can. I got my email system, working pretty well, so just get on that, and so you can know about any other information that we can give you. But right now, what you can do, talk to Rhonda up in the front and see if you can get in, next week. We have some limited spaces, but we'll make some room for you guys. It's usually like a 15-minute session that we just talk about it. No commitment. We're not gonna. You don't have to pay for it. It's just you just come in, bring what you got. We'll look at it, tell you what we can do, give you a plan, and then go from there. That's it. All right. Well, thank you for coming.
Thank you.